This original WSRE presentation is made possible by viewers like you. Thank you.
Fighting the opioid crisis on multiple fronts, the personal and financial horror this epidemic is placing on our society. On this edition of inStudio. The number of overdoses and deaths related to opioids are staggering, but below the surface there is something even more sinister going on. Newborn babies going through opioid withdrawals, families and businesses being torn apart, and communities struggling to provide needed manpower and money to fight this epidemic. On this edition of inStudio, we'll look at the causes, possible solutions, and long-term burdens being put on our community. Mike Papantonio is one of the nation's most prominent civil trial lawyers. He is also a respected and sought-after media analyst, commentator, and host, appearing on major television networks including MSNBC and Fox News. He currently hosts America's Lawyers on the RT America Network and the nationally syndicated radio show Ring of Fire. Papantonio and his firm want to use the courts to help state and local governments recoup money spent fighting the opioid epidemic. Dr. Robert Althar is with the Lakeview Center and specializes in Suboxone therapy, a treatment to help those addicted to opioids and other prescription pain pills. For the past 30 years, Dr. Althar was a general surgeon. His current focus is the medical treatment of opioid dependencies. Colonel Robert Quinata has spent nearly 2 decades with the Escambia County Sheriff's Department, office. Most of his career, he has worked in narcotics, both as an investigator and supervisor. Additional assignments have included patrol, major crimes, and SWAT. These days, he is in charge of the Investigations Division, as well as serving as team commander for the agency's SWAT team. Gentlemen, thank you so much for joining us and welcome. Doctor, let me begin with you. What is an opioid?
Opioid is a term that's more accurate than the word narcotic because it includes the synthetic opiates like fentanyl and hydrocodone. So it's called an opioid because it has the same characteristics as an opiate.
And kind of expand a little bit on that. So give me some examples of those drugs.
Pain medications, Lortabs, Percocets, Dilaudid, OxyContin,
okay.
Heroin.
Heroin, okay. And so that one sort of seems to move outside of what we would generally think of, but that's becoming a major problem.
It's a huge problem. People self-medicating with heroin.
And we're going to discuss that more and more as the program goes on. Mike, tell me what your firm is doing.
Well, counties and cities all over the country, Jeff, have lost tens of millions of dollars. I mean, this is an industry that's a $100 billion industry. They dumped, it's clearly just what we would call narcotic dumping, in cities where the city then had to pay for extra law enforcement, extra health care, rehab, dependency hearings where children have been taken away from their parents. The cost in a typical community can range, a community this size, it can range anywhere between $50 to $100 million. So the industry made billions of dollars, passed this problem on to the communities, actually to taxpayers. It's called externalizing all risks. They've externalized everything that was bad about the process. They've externalized to the taxpayer in the community. And now the tail of this, where we have heroin epidemic right behind the opioid epidemic, or both of them working together, is all part of continuation of that opioid epidemic. So it's so what we're doing, we've been hired all over the country: Ohio, West Virginia, Kentucky, Alabama, Florida. We're hired to go to these companies, go to court, and show juries how these companies actually knew exactly what they were doing. The diversion process, the abuse process was actually part of their business plan. There are documents that actually show that was part of what they knew or should have known was going to happen. By year 3, in their distribution of these opioids, everybody in the business knew about the abuse. So, but their argument is, gee, we just didn't know until year 3. Okay, give them till year 3. But then there's years 4, 5, 6, 7, 8, 9, and 10 where they knew exactly what they were doing. They were building the addiction process. They were building the diversion process actually into their business plan. Mm-hmm. They knew they could sell more opioids that way.
Is this similar to what happened with tobacco?
It's more nefarious than what happened to tobacco, because at least with tobacco, there was a pretty good, everybody understood clearly what was happening. In this instance, you had the industry actually paying what I call biostitutes. That's where you go to a university, you hire a character like Dr. Portnoy that was their big cheerleader. Portnoy creates all this phonied up literature, starts convincing doctors, treating doctors, that everything's okay. The doctor doesn't really understand it. The doctor's being told by the salespeople, gee, this is for long-term use, you don't have to worry about it, doc, this is not really all that addictive. And then that becomes the myth of the opioid that lives for about 5 years within the profession.
Colonel Quinata, what are you seeing on the streets?
We're seeing all of it. We have not seen the heroin hit so bad. I'd say in the last 5 years it's really hit. Once the pill mills were shut down within the state is when it really got bad. When they started self-medicating, as it was put, with heroin. But what our concern on the law enforcement side is we target the suppliers. That's the ones that we want. That's the ones that are bringing it into the county, bringing it into the state. But to get to them, we have to go through the users. We, in essence, are the first line into the recovery process because they do get options. You know, if we catch someone that's using heroin, they go to the court and they may get drug court. But by then, it's just, as it's been pointed out, they're already addicted. It's gotten so bad that we, as law enforcement officers, are busting down doors and search warrants, and we are affecting families. We're part of that process where we're taking kids away. What's gotten so bad, as opposed to the pills, as opposed to any other drug, crack, marijuana, anything like that, is the number of overdoses that we're seeing. Death overdoses. So what we are trying to do is starting to target those suppliers and charge them in criminal court for the death of the user.
Interesting. You said something about pill mills, and I want to ask you about this because we were talking off camera and you were kind of talking a little bit about how the whole pill mill situation has caused an evolution. Tell the story.
When the pill mill law was passed, there were only 5 specialists or subspecialists that could prescribe long-term narcotics for non-cancerous pain. And there are many patients that need that treatment. There just weren't enough doctors to go around, so patients began buying pills on the street, which supply and demand, the price went up to the point where heroin's cheaper, considerably cheaper. So now heroin is the drug of choice.
Interesting. You were talking about you're seeing more and more overdoses. And I'll throw this open to all of you. What's causing that? How are people getting themselves in that position to overdose?
Compared to 2002 or 2001 when I first started narcotics, you didn't see heroin on the street. You barely saw a Lortab pill or a Percocet, you know, depending on the age group, because I do believe it is more influential in different age groups. But the overdoses we're getting these days, you know, 2015, 16, and 17, is heroin mixed with fentanyl. That's the lab reports that are coming back from the ME's office. Those are field test kits that we're using out on the street. When we catch someone with a bundle of heroin, it's testing both for heroin and fentanyl. And it's...
Yeah, part of the problem that we see, and when understand we're talking to cities and states and counties that are hiring us and they give us these details. The details are staggering. 90 overdoses a day sometimes in some of these communities is not unusual. And the thing that the real problem is most of these counties don't even have the money to pay for naloxone, which is something that saves lives. With an overdose, it can save somebody's life. And they've even reached out to some of these distributors to say, look, you helped create this. We need some help here. We need money solving this problem that you've created, and they simply haven't got any cooperation at all. It's not that these counties have not tried to get these companies to, Amerisource, Cardinal, McKesson, These companies knew exactly what was happening. Jeff, here's what's important, and I know you may have seen some of this, Robert, but you've got a, let's talk about the distributor aspect of it. You've got a pill mill, all right? The pill mill is on, let's say, 3rd Street in a city. The people selling, the people that are actually the distributors for McKesson, for example, may be on 7th Street. They drive by, they see the pill mill, they see people out there standing in their pajamas at 7 o'clock in the morning for their pills. They hear about the overdoses. It's tangible to them. They see the reports, they see the newspapers. So they absolutely knew what was happening, and what was happening started about 3 years into it. And so for them to say, gee whiz, how could we know this diversion was not something that we could understand? They actually built diversion into their business plan.
Kind of what you're seeing on the streets, huh?
That is what we saw. I mean, you're talking, this is a cash business. We're not talking about legitimate individuals selling this stuff. We're talking about people that are there that have no regard for other people's safety or lives, that are making money cash in hand, and that's what it's all about.
You mentioned fentanyl, and that's something that I saw come up time and time again in some of my research. Doctor, explain exactly, what is that? What is fentanyl?
Fentanyl is an opioid. It's a synthetic opiate. It's widely used, and it's a good drug used widely by anesthesiologists, and it's used by pain clinics. But what's happened with heroin is it's been cut so many times that they put fentanyl in it to give it more kick, to make it more attractive to the user who doesn't know what he's getting. And then they get a batch that has a little too much fentanyl in it, they overdose, they quit breathing, and they die.
Wow.
And what Mr. Papantonio was talking about was the use of naloxone, or Narcan is a trade name, in the hands of first responders. We're also, Lakeview, trying to look into getting naloxone, Narcan, into the hands of the family of the dependent person, because the Narcan reverses the respiratory depression caused by narcotics or by opioids. And someone who overdoses simply quits breathing.
And this drug reverses the process.
Yes.
Interesting.
And the patient starts breathing again.
Interesting.
Sometimes not happy.
Yeah. They're not happy?
When they wake up, you interrupt their high. We've experienced they are combative, they're upset, they're less than pleased that their high is gone, because just as the doctor said, and he knows more about it, it completely reverses the effects.
Wow. That fast, huh? I mean, is it just...
Very quickly.
Yeah.
Wow.
It's what a great idea, Doctor, putting this in the homes of people that have somebody in their family that is an addict.
That's
I mean,
at
what
risk.
a great idea. I mean, that can save a lot of lives.
It could.
Not only are we going to continue to talk about the problem that the opioid epidemic is causing for our communities, but we're also going to talk about some solutions when we continue. So I hope you'll stay with us as we continue our discussion on the opioid crisis, the causes, and, as I said before, some of the solutions. You're watching In Studio on WSRE Television, PBS for the Gulf Coast. We're coming back in just a moment.
From its beginning in our registration center to its current state-of-the-art facility in the Kugelman Center, WSRE has been a center of excellence on our Pensacola campus for the last half-century. Through the years, Pensacola State College has supported WSRE's mission of providing high-quality, non-commercial educational television. I personally support our PBS station because WSRE presents the best of history, science, culture and public affairs, as well as award-winning children's programs that promote early learning in engaging and innovative ways. And our local programs focus on issues and events that are important to this region. Congratulations to WSRE on its 50th anniversary.
If you value local programs that enlighten and empower viewers to make a difference, then tell us. Pledge your support for WSRE and be more.
Welcome back. This is In Studio on WSRE Television, PBS for the Gulf Coast. We are discussing the opioid crisis and how it is affecting our community. Our guest, Mike Papantonio from the Levin Papantonio law firm, Dr. Robert Althar with the Lakeview Center, and from the Escambia County Sheriff's Department, Colonel Robert Quinata. Doctor, let me ask you, in your experience working with Lakeview and working with patients, what's the typical profile of the opioid addicted person?
This disease, and it is a disease, we know in 2017 that this is a disease like diabetes or hypertension. 90% of my patients have family members who have alcohol or drug disorders. So we can diagnose it, we can treat it effectively. In our clinics, and Lakeview has several clinics. I work in two. One at the Summit Group, and we treat patients with opioid disorders. We also have a new program called the STOP program that is on Lakeview campus near Baptist Hospital, where we treat indigent patients with opioid use disorder. And there, the medical care and the drug we treat them with, buprenorphine, and the trade name is Suboxone, is at no cost.
Okay. So
we're reaching a part of the population that cannot afford to buy the medicine or get the care they need.
What should a family member be on the lookout for if they suspect that one of their loved ones may be starting to develop a problem? What are the early telltale signs?
The patients have a behavioral change. They don't care how they look. They may sleep all the time. They may have needle marks. They try to cover it up, but family members know. They know there's been a change, but they don't know what to do about it. Where do they go for help?
From a law enforcement standpoint, Colonel, what are you seeing? I mean, is this something that runs across just a broad spectrum of the community?
It does. I mean, the doctor mentioned needle marks and things like that. You equate it to what you used to see on TV, needle marks in the arm and things like that. That's not such the case. You know, it's between the toes, and it's very well hidden. A good heroin addict knows where to hide it. But in addition to the heroin, you're talking about the pill addicts that are still using the pills. That is, from what I've seen, it's completely different. It could be a businessman. It could be somebody who is, contributing to society. You just wouldn't know it. You wouldn't be able to look at a person and say that person right there is hooked on pills or anything like that. But the heroin addicts, a very good description, unkept. All of their taking care of themselves abilities are diminishing, and they do sleep a lot because it is an opioid. It's a downer.
Mike, in your research, what are you finding that is there any particular group or any particular personality profile that seems to be more apt?
That's what's so amazing about this. There really are no limitations. There's no bundled groups. There's an incredibly important book out. It's called Dreamland, and it's a book about the opioid crisis in the United States. It was done by a Pulitzer Prize-winning author. And he tells story after story of all-American kids. They're football quarterback, injured playing football, goes to the doctor gives him 70 OxyContin. Within 2 weeks, he's hooked. It becomes something that follows him. Those stories are very, very common. Child goes to a dentist. Dentist does a root canal. Dentist gives them 50 opioids. And all of a sudden, the next thing you know, that child is willing to give up everything, willing to give up their family, their health, their future, simply to be able to get another hit of that opioid or when the opioid's not around to get a hit of heroin. It was so interesting the way that I call it the tail of the problem. And you would think I know, Robert, you've probably seen this where you see a child that is overachiever in every way. Doctor, I know you've seen this, probably overachiever in every way. Great in school, would be considered by any standard an overachiever. And all of a sudden, they into their pill addiction, they say, well, okay, I can buy heroin for a little less than I can out on the street, than I can buy a pill out on the street. So they make the heroin move. It's not as if there's any personal resistance to it, because it is a disease. I mean, as doctors say, it's a disease. And so what we hear when we talk to these folks all over the world, and I'm talking about Ohio, Kentucky, predominantly, interesting thing, predominantly in areas where there was very significant economic despair. This is an interesting part of it. And it ties into the user a lot. We found out that the industry actually targeted certain areas. They would, first of all, they would say, okay, what is the economic setting of that area? Is it economic despair? Have jobs been outsourced? What's happening to the middle class there? They go through a pretty interesting analysis. And then they say, how many pharmacies are in that area? How many hospitals are in that area? They can look at all these statistics, and they actually targeted places. If you look at a map, it's very interesting. You can see the pattern quite easily. And then after the opioids move through, there's a place in Jalisco, Mexico, where what we call black tar heroin. I don't know if you're seeing this up here, but black tar heroin is the cheapest of the cheap heroin, probably one of the most dangerous. But that part of Mexico was sending kids. And interesting, Jeff, we would consider these kids that are sending to the States to sell this black tar heroin, these aren't gangster kids. If you compare them to you'd say this is an all-American kid. The same way you would evaluate them for where they come. They're farm kids. Mm-hmm. They come from farms, and they're sent to the United States. They drive. The people who send them to the United States give them a car. They say go to the local Target and dress exactly like the people that you're going to be dealing with. These kids drive around with heroin in balloons that they keep up in their mouths with a card. I don't know whether you've experienced this, but we certainly have in Chicago and some of the bigger cities. They actually carry cards. They will hand a card to somebody who is obviously addicted or who wants to buy. That person calls Jalisco, Mexico. Jalisco, Mexico calls this young man, says, meet on the corner of 5th Avenue and you'll have a customer. And the worst that's going to happen to that child, he's going to be sent back to Mexico. And they're not even really, these kids aren't making tons of money. They're getting $800 a week, most of which is sent home to their family in Mexico. So it's so complicated. I mean, but the way kids are affected is they can't talk themselves out of doing this. They can't talk themselves out of the use of heroin. It's a monster.
Go ahead.
When patients become addicted, there's usually two ways. They may start out as recreational users, and then they have the genetic makeup that makes them become dependent easier than, say, you or I, who doesn't have that genetic makeup. And they start using, and they start using pills, and then they start crushing them and snorting them. Then they start using them IV, and the price goes up. And the patient initially starts out because they like the euphoria, they like the rush, they like the drug. But soon, within less than a year, they don't get a rush anymore because of tolerance. Tolerance is where you need 2 pills to do what one used to do. So now when they wake up, they're just looking for a drug to prevent withdrawal. And withdrawal is 10 times worse than the worst flu you ever had. And it's fixed by using another opioid. So they are very dependent on it, and human beings, without help, 99.9% cannot stop using narcotics when they become dependent.
And how do you help them get off of it? I mean, how do you break that cycle?
We have a comprehensive program at Summit and at Lakeview at the STOP program. It's a combination of medically assisted treatment, which is the buprenorphine or Suboxone, and psychosocial support. And it's comprehensive. It is not a doctor writing a prescription and showing them the door. The patients need to get involved at the STOP program, which is the state targeted opioid program. They're required to go to group counseling. They have individual counseling. It's a comprehensive program and our goals are over a period of X number of months, which is different for each patient. The end that we want to get is the patient has built a purposeful life and understands the root cause of why they self-medicated.
You said some of it starts off as recreational use. I guess the other thing, oftentimes. So in other words, it may be somebody in a party situation. I want to get high or whatever. But talk to me a little bit.
I didn't get to that part. Oh. The two parts.
Go ahead.
The other one is auto accident, broke his leg. Now he's on narcotics, and he may need to be on narcotics for 2 or 3 months. But then it goes on, and they become dependent, and then they buy them on the street. And then they can't run their lives. The narcotics take over. Patients who take narcotics, first of all, they can't think straight. Their thinking is clouded. They don't feel emotions. They're suppressed by the narcotics, and they're depressed because narcotics cause depression. So now you have a patient who's depressed. Well, I'm depressed, so I better take a narcotic. I took a narcotic, and that makes me depressed. And that cycle goes on right down the drain.
This is what you're talking about, Mike, as far as the person who was injured and they start taking and become addicted.
Yeah. And so oftentimes the doctors are blamed for it wrongly. You know, I think that's the thing that infuriates me the most is when I hear the industry blame the government, they blame law enforcement, they blame doctors. Listen, this is an industry that went out and hired people to write phonied up literature that they could give to treating doctors and say, look, doc, you can use this OxyContin way beyond what everybody's telling you because Dr. Portnoy and his team who did all this research, and then they'll hand them a bunch of phonied up literature, who did all this research, well, they've concluded this just isn't a long-term problem. But nevertheless, when you ask a person about, well, who's responsible, they want to say the doctor. Well, listen, HHS, how crazy this is. You probably start seeing a big difference, Robert, HHS in 2005 or 2006, doctor, I forget which year it was, sent out a letter. This is the hospital, this is the National Hospital Organization. They sent out a letter to doctors saying you're not prescribing enough pain medicine. Yeah, I mean, matter of fact, they started, you know more about this than I do, Doc, but they actually started dinging hospitals, actually attacking hospitals for not selling enough narcotics because they said this is the new big public health threat is people are in pain. I mean, you can talk about this more than I can, doctor.
That was several years ago, and the Joint Commission for the Accreditation of Hospitals, which every hospital gets an audit about once every 3 years. And if they find what are called deficiencies, they call it dinging the hospital. The hospital is under great pressure because if they're not accredited by the JCAH, they don't get paid for taking care of Medicare patients. So it's a do or die situation for the hospital. And physicians who work at the hospital want to support the hospital were told by the Joint Commission, you need to prescribe more pain medication. And so they did.
Amazing. And as a matter of fact, but people don't know that. The industry drove the literature that created that. The industry hired these biostitutes to write the literature that created. You know, the smiley face, you know, this is the fifth clinical, I think it's called the fourth or fifth clinical test. And we say, you know, you see the smiley face, what's your level of pain? Well, smiley face, a frown. The industry came up with that. They came and they pushed that. And they created this whole aura around how people are suffering all over the country, and we have to do something as a medical profession. The industry pushed that narrative.
Interesting conversation on the opioid epidemic. When we come back, we'll continue our discussion and find out what some of the solutions may be. You're watching In Studio on WSRE Television, PBS for the Gulf Coast. Hope you'll stay with us. We're back in just a couple of moments.
American Graduate is proud to recognize a champion for education.
Autism Pensacola is a support group for those living with autism, and we seek to improve life for those living with autism.
They have given us an opportunity to be part of our son's education, to be part of his playtime. They care about inclusion and acceptance.
And our goal, of course, is to increase children's independence and help them be successful in school. We want teachers who are equipped to meet the needs of children with autism in the schools. WSRE has been a great partner with Autism Pensacola, providing us with PBS resources and helping us further our mission. We know that working together as a community, we can improve life for all of those living with autism and have great outcomes.
We get to see these kids make such great gains in communication and in social skills. So it's so important for families of autism to have this wealth of information as well as support.
And it's so meaningful when a parent comes to you and says, you know, this is just what I needed for my son. It's made such a difference in my child's life. The more we do for them as children, the more positive their outcomes will be as adults.
Autism Pensacola, helping children and families connect the pieces. For more stories of champions, visit americangraduate.org.
Welcome back. This is In Studio on WSRE Television, PBS for the Gulf Coast. We are discussing the opioid crisis and how our community and nation as a whole is being affected. Our guest, Colonel Robert Quinata from the Escambia County Sheriff's Office, Dr. Robert Althar with the Lakeview Center, and Mike Papantonio from the Levin Papantonio law firm. Colonel, Mike mentioned a few moments ago about this black tar heroin. Is this something that you're seeing in Northwest Florida?
We've only seen it once. In my tenure back in narcotics, which began in 2001, we saw it a few years ago. That's the only time we've actually ever seen it. But again, we're talking about a drug, heroin, fentanyl. It's very easy to hide on the user level. You know, distributor, not so much, but a user, it could look like anything. A piece of lint in your pocket, the way it's packaged, the way it's sold. You have to know what you're looking for.
It's interesting you say that, because I read something that it's like some of it may be the size of a grain of sand or something like that. Is it?
Yes.
So it's that small,
yeah,
and that powerful.
That small and that powerful.
Wow. How is this stuff getting into the United States? Or more importantly, how's it getting into Escambia County and Santa Rosa and Okaloosa counties?
What we're seeing, heroin is pretty, it's coming from south of the border. Hands down, it's coming from the south of the border via Texas, through Atlanta, down to Florida, the Panhandle. You're not seeing anything from what we call, or what's referred to as the Golden Triangle, Asia, Afghanistan, or anything like that. The reason I say that is it's a completely different color. What we're seeing locally is a brown, more brown than white. The term's been used in the past, China white. That's coming from the Asian realm. So what we are getting is absolutely hardcore cartel heroin.
Well, go ahead.
Well, that's what that's what they're seeing just about everywhere. You know, but you say, where's it coming from? We can't forget where it came. It initially came from manufacturers. Purdue started this whole thing. Purdue, their first year, they made $148 million. By year 3, they were making $6 billion a year on OxyContin alone. Matter of fact, just recently you had incest, which was a manufacturer's fentanyl, that they were busted up in New Jersey, in the state attorney's office up there, found that they had a plan underway to what they call off-label the drug. In other words, you know what off-label is, doctors, where they go around and they tell a doctor, yeah, this drug has been approved, for example, for cancer. A cancer patient that is suffering from just horrible, horrible pain. Well, that's what this particular drug would be used for. And then all of a sudden you have distributors, salespeople that are going, you know, doc, you can use this for other things, and they would give them some reason why they could, and it's called off-labeling. So they were caught off-labeling this very, very powerful drug that was initially used for cancer treatment, and they fined him some pittance amount of money, $500,000. That company made that much money while we've been having this conversation. And that's part of the problem. The problem is law enforcement has to throw these users in jail. But what about the character on Wall Street in an Armani suit who's sitting up in a tower making decisions like this? You know, he's got a Rolex watch, drives a Mercedes-Benz, so he doesn't look like a criminal. He is a criminal. That person is a criminal. That person understood exactly what was happening. Why don't we throw that person in prison, and then we change the dynamics of this whole process 10 years from now? Because somebody 10 years from now says, you know, I looked at my history books and there were 8 people thrown in prison at the top of the food chain for these decisions that were made. That's the only way you'll ever change this kind of thinking. You can't throw the character that's on the street corner you know, selling 2 ounces of marijuana in jail and ignore the guy that's making $10 billion a year, understanding exactly what he's doing, pushing a pill that they know exactly what's happening with that pill. How do we do that?
And through your research and investigations, you've been able to find evidence that these guys are communicating, we know it's a problem, and just it's all about the...
Listen, these are companies that have already paid fines for that. They've had to admit that they have done this. They've had to admit that, yes, we off-labeled. Yes, we failed to warn. Yes, we marketed in a way that we knew was going to be explosive and was going to be diverted. We knew all that. They paid fines, but nobody went to jail. Now imagine that you've sold $10 billion worth of narcotics that actually has kids addicted to heroin, their lives ruined, and you pay $1 million, $2 million, $10 million, $50 million. Who cares? It doesn't change until they throw you in jail.
Why do you think that hasn't happened?
Because it's the way that we're built. It's that you've got a Justice Department that's dysfunctional. You know, local law enforcement's doing everything they can do to solve the problem. You got Washington, D.C. with a national Justice Department who, you know, they talk the talk but won't walk the walk. You know, it's no different from when we saw Wall Street steal $8 trillion from the American economy. We know who stole the money. Wall Street did. They knew exactly what they're doing. How many went to jail?
Yeah.
0.
What Mr. Papantonio is talking about is his approach, and it's very valid. But this is a national problem, and it's going to take a multifactorial approach to deal with it. Narcotics are so powerful that us mammals, our #1 instinct is to breathe. Narcotics are so powerful that they overcome that. People who die from a narcotic overdose simply quit breathing. They're powerless to do anything about it, but there is hope. There is treatment. There's medical treatment. There's medically assisted treatment. There's psychosocial treatment. And when used together, it's very helpful. Patients can change their lives. They don't necessarily ruin their life for the rest of their life. They can turn it around. The medication that we use is buprenorphine, or trade name Suboxone. This takes away cravings. It allows the patient to build a purposeful life, to get a job, to go back to school, to better themselves. And we see it trickle down to the community, because now this patient's in treatment. They're not going to overdose and die. They stop spending $3,000 or $4,000 a month on the street buying drugs. So now their family has a roof over their head that's secure. They have food. It affects everybody who is around that dependent person is codependent. So we're treating all of them.
Once someone is on this Suboxone, is this something that they take for the rest of their lives?
No.
Okay.
The program is usually 12 to 18 months because it takes that long for a patient to build a purposeful life, which is one of the reasons if they go to treatment for 30 days, they come out, they relapse. The relapse rate is high because they go back to their same community. They're back with people they used to use with or buy from. We require patients to get rid of those people. They can't have them in their life. They're too much of a trigger. And then with psychosocial support, they start to understand how they were medicating themselves to deal with life's problems or mental illness. It's very common. People with anxiety take narcotics thinking it makes them feel better, but it makes the anxiety and depression worse.
Colonel Quinata, I saw you shaking your head when the doctor was talking about people go back and they get around these dubious characters again and again. How many times do you go back to the same house or to the same situation?
I don't mean to crack a smile, but you know, the doctor mentions that, and I can think of just by heart 5 houses that we have hit several times for the same type of problem. When it comes to heroin, not so much, because we always see these same people again, to the point where they remember us. They remember your name. I'll be walking down the street, I'll be in Walmart shopping, and I'll hear, "Hey Q, Mr. Q, how are you doing?" And it's a guy that was arrested by, guys on my team at the time I was in narcotics. But, he's right. It does take, and I'm glad to hear, because I have been educated sitting here, especially dealing with, hearing from Lakeview side, the comprehensive, treatment and everything, because the 30 days, let's take drug court, for example. And as Mr. Papantonio brought up, it is frustrating for law enforcement to know that there is an individual sitting on Wall Street, a hire guy that is basically untouchable. I can't touch him. I'm a deputy with Escambia County in Florida. We can feed the information to DOJ and Department of Justice and all them, but is it really going to do anything? It's frustrating, to say the least. But when you got a guy that is an addict, a true addict, the frustrating part comes in where, let's say I'm an addict. I go to court and the judge offers me drug court. That is an opportunity for me, if I want it, to get treatment. Mm-hmm. If I don't abide by the rules, it's pretty much like probation, then I'm looking at getting locked up. But where it is, dealers take advantage of that. They truly take advantage of it, because the people that need treatment, as the doctor's explaining, the true addicts who have a problem, have a disease, they need the treatment. But your dealers are going in there and they're being told, hey, go in here and ask the judge, plea out to your charges for drug court. Those aren't the guys that are using it. Those are the guys that are pushing it. So they're taken away from the individuals the doctor could be working with to keep these people off.
Wow, interesting. We will continue our discussion on the opioid crisis when we come back. You're watching In Studio on WSRE Television, PBS for the Gulf Coast.
What can we do when we're in the Pensacola area? What can we do in Northwest Florida? What can we do in South Alabama?
People have the opportunity to go down 3 levels.
I'm Sherry Hemminghouse-Weeks, and I host a show called In Your Own Backyard. I get to share amazing stories with incredible viewers about a place that I love, and it highlights all kinds of area attractions, historic sites. We cover so many vast and different things. Sponsors want people to know about that too, and so that's why it's important to have the viewer support and also the corporate support, because they're only promoting and helping their communities all the way around. It's a privilege, and I'm so excited to be able to do it.
If you value local programs that don't just educate, but enlighten and empower viewers to make a difference, then tell us. Pledge your support for WSRE now and be more.
You're watching In Studio on WSRE Television, PBS for the Gulf Coast. We are discussing the opioid epidemic and the effects on our community. Our guests, Dr. Robert Althar with the Lakeview Center, Mike Papantonio with the Levin Papantonio Law Firm, and Colonel Robert Quinata with the Escambia County Sheriff's Office. Doctor, let me ask you this. When I was talking to someone about doing this program, they said to me, well, I think you've got to be careful about too much regulation in this area because there are people with legitimate concerns as far as pain, chronic pain that goes on for an extended period of time. So let's say somebody has some sort of chronic pain. What's the answer?
There are many pain clinics. Legitimate pain clinics. There's a legitimate patient. I'll give you an example. Joe is a bricklayer. He fell off a scaffold and broke his back. He's a hard-working guy that wants to get back to work, support his family. He can't do it without pain control. So that's legitimate. Mm-hmm. Also, there are other situations where they're not going to have chronic pain. They broke an arm. They're going to have pain for a while, but then the pain medication, the patient wants to stay on it because they're dependent on it. And this is, in great extent, this is a societal issue. There's an amazing statistic, and that's the last one I'll say today, is that of all the opioids manufactured in the world, the United States consumes 80% of them.
80%?
Correct.
OxyContin, it's 95%.
Wow.
We have a society who wants immediate gratification and a society that thinks they should have zero pain, which is different than our ancestors. And it's a societal issue. It has to be approached multifactorially in order to get any kind of a handle on this. We have to change the way we think.
Well, you know, what I thought was interesting is that at the break, Robert was talking about the fact that talking about a Marine that maybe we talked to, and the Marine sprains an ankle, and they don't give him 70 days of OxyContin. They give him ibuprofen, I think is what you said. And behind this story is a story. And the media did not tell the story. Corporate media didn't tell the story because these companies like McKesson and Amerisource and Cardinal, they're advertisers. So why would a CBS tell a story about their advertisers? They didn't tell these stories until it became impossible for them not to tell the story. And one part of the story they never told, they still don't tell, is that in 1970, under the Substance Control Act, these distributors were given this, here was the mandate. Yes, you may distribute this highly addictive pill, but at the end of the day, you're responsible. And what you're responsible is if you see anything, this is in the statute. If you see anything suspicious, if you see numbers that are inordinately high, you may connect with your local community as a citizen living there and gather from that anything that's abnormal. All of this is right there in the statute. It talks about yes, you can do this. And so Amerisource, Cardinal, and McKesson sell they distribute 85% of this. You understand? There are many distributors, but these three distribute 85%. And all they were asked to do is when you see something abnormal, tell ARCO. You know, tell the DOJ. ARCO is a central kind of reporting organization. Let the DOJ know about it so we can do something about it. Unfortunately, sometimes they told the DOJ, sometimes they didn't. Sometimes they told the DOJ and the DOJ did nothing about it. But the point is they were the gatekeeper under the Substance Control Act of 1970, and they knew they were dropping the ball. 21 CFR said exactly what they had to do. They knew they didn't do it, and still they continue not to do it. So that's part of the problem.
Did you want to add something?
No, I was just thinking
I
about
thought
the
you were
next
scribbling
thing.
something down for a second.
One thing about this disease that's different. If you have hypertension, you have high blood pressure, that's treated. This disease is not only physical, it's mental. Its brain and body are affected. And these people need help. They need to know that there is hope.
Right.
And there is.
And I want to just backtrack one quick second here on the pain issue. There are other drugs out there, I'm assuming, that you can use if you have the broken arm or the dental issue or things of that nature that are not so highly addictive, correct?
Well, there's no problem with prescribing opioids for short-term pain control, let's say post-operatively. There's no problem with that. That's what the drugs do, and they're very good at it. It's when the patient begins to chronically take the drug, they develop tolerance. They develop changes in their brain. People who are narcotic addicts, for example, they don't have goals. And they can't set a goal because that part of their brain is shut down. After they get in treatment, that's one of the things we look for. It's a sign of health that they're now starting to think about goals. But during their addiction, they can't. The other thing during their addiction is these patients have a distorted perception of reality. What they think and what they feel is true is absolutely not. It's distorted completely.
Powerful stuff, powerful stuff. Colonel, from a law enforcement standpoint, since this is starting to become widely talked about, are you seeing any improvements? Are you seeing anything change on the streets?
No, I'm not. It's still continuing to get worse. The numbers, quite frankly, are the same.
Really?
The number of arrests that are made, the number of search warrants that are being served, the number of complaints that we get called in about, whether it's pill dealing, heroin dealing, fentanyl dealing, anything like that, it is consistent.
As a law enforcement officer, what advice would you have to the medical community and to the legal community like the DOJ and folks like that who can make a difference? What would you, if you had a moment to sit down with them, what would you tell them?
Along with them and the community, this should not be, it cannot be solely rested upon the shoulders of law enforcement. It cannot solely be rested upon the shoulders of those in the medical field or in the legal field. This is a community problem. It was mentioned earlier by the doctor, suggestions to the family, what should they do? Yes, Narcan's a good idea to give to known addicts, but a lot of people just don't want to get involved for fear of reprisal. But we're talking about two types of drugs, mainly heroin and pills, Percocets, Lortabs, OxyContin, and everything like that, that have a very high potential among any other drug to kill somebody, to cause death, as opposed to cocaine and the other drugs. So they need to get involved. If it was DOJ, I'd say, after listening to Mr. Papantonio over there, go after Wall Street. Make a statement. Be the one that makes a statement.
Mike, I'm getting a little short on time, so in about 2 minutes, what do you ultimately hope to accomplish?
I hope to help these counties get their money back and enough to help law enforcement go forward, enough to help hospital rehab go forward, enough to help these dependency courts where children are being taken away from their parents, to go forward. I hope to have an action plan that builds an infrastructure around a problem that will not be solved unless there's an infrastructure to do it. That means having people that every day are looking at, are we getting better or are we getting worse? Do we have an naloxone program in place to help on day 3? Do we have a law enforcement training that helps them with their job? I mean, these officers are put out there in very dangerous situations. Some of these folks are downright dangerous. Yeah. And so we haven't even told them what the problem is. We haven't told the EMS what the problem is. We haven't told the hospitals what the problem. They've had to figure it out on their own. We can do better than that. We can have these companies pay for a structure that changes the way counties do business and pays these counties back, these cities back for these losses, and going forward has something like we did on tobacco. It's what we done on tobacco. We put together a fund that advertises, don't smoke, it will kill you. And now, you know what? Smoking in the United States is declining among young people.
Doctor, in about a minute and a half, what can the medical community do?
Refer patients to comprehensive treatment programs, such as Lakeview has, in multiple communities. To the Shalimar and Destin, we have treatment centers here, both methadone and Suboxone clinics, but it has to be a comprehensive approach. You talked about using government funds. We have a government-funded, state of Florida funded STOP program, STOP, State Targeted Opioid Program. And this is where we're treating indigent patients who can't afford treatment with no-cost medical care and no-cost drug. And we're making a change. We make a change one patient at a time. But that patient impacts everybody else in his family.
Right. It's a compounding situation. Gentlemen, I will have to say it has been quite an enlightening discussion. I thank each of you for your expertise, and certainly we hope that this situation will start to take a turn for the better as it becomes more and more publicized, and as people realize the dangers and the horrors that it is causing in our community. And I'll be just frank about something. I knew it was an issue, but until I really started digging into it and researching this program, I frankly didn't realize just how bad things are. So anyway, hopefully things will begin to change. We have been discussing the opioid epidemic and the effects it is having on our community and our nation as a whole. Our guests have been Mike Papantonio from the Levin Papantonio law firm, Dr. Robert Althar with the Lakeview Center, and from the Escambia County Sheriff's Office, Colonel Robert Quinata. This program will be available online at WSRE.org as well as on YouTube. Please feel free to share. I'm Jeff Weeks. Thank you so very much for watching. I hope you enjoyed the broadcast. Take wonderful care of yourself. We'll see you soon.